You have had back pain for years. You have tried everything. Rest, heat pads, pain medicine, maybe even physiotherapy, and it gets a little better, and then it comes back. Every time. And somewhere along the way you started to believe that this is just your life now, that this is what getting older feels like, that nothing is really going to fix it. But here is the thing nobody has said to you clearly. Your back pain keeps coming back because the real cause was never properly explained to you. Not because you did not try hard enough, not because your body is broken beyond help, because you were never given the full picture. Today we are going to give it to you. Stay until the end, because the last cause we explain is the one that keeps more seniors in pain than any other, and it has nothing to do with your spine. Welcome back. Today we are talking about something that affects the majority of seniors every single day: chronic back pain. Not a sudden injury, not a fall, but that persistent, returning, nagging back pain that has been part of your life for months or years. We are going to explain why it keeps coming back, what is actually happening inside your back, and what needs to change for the pain to genuinely get better. Simple words, honest answers, no complicated medical language. Let us start from the beginning. Your back is not one simple structure. It is a complex system of bones, discs, joints, muscles, ligaments, and nerves, all working together. Think of it like a tall tower built from 33 blocks stacked on top of each other. Those blocks are your vertebrae. Between each block there is a small cushion. That is your disc. Around the whole tower there are cables holding it upright. Those are your muscles and ligaments. When everything works together, the tower is strong, flexible, and stable. But when one part of the system weakens or wears, the whole tower starts to strain. Other parts compensate. They work harder than they should, and over time, they start to hurt too. This is why back pain almost never has just one cause. And this is why treating only one thing, only resting, only taking painkillers, only stretching, often brings only temporary relief. The full system needs to be understood. So let us go through the real causes, one by one. The first cause is disc wear. Between each vertebra in your spine, there is a disc, a small round cushion made of tough outer cartilage and a soft gel-like center. These discs do an enormous job. They absorb shock. They allow movement. They keep the bones from grinding against each other. But over decades of use, these discs gradually lose moisture. They become thinner, less cushioned, less able to absorb the load placed on them. When a disc thins, the space between the two vertebrae above and below it narrows. The bones get closer together. The nerves that exit the spine in that area can get pinched or irritated. And a pinched nerve does not just cause local pain. It can send pain, tingling, or numbness down the leg, into the hip, into the foot. This is what many seniors experience as sciatica, that shooting pain down the leg that seems to come from nowhere. It came from the disc, and from the nerve that the disc is now pressing on. Here is what most doctors do not take time to explain about disc wear. The disc itself does not have pain sensors. You cannot feel the disc wearing down. What you feel is the consequence, the nerve irritation, the muscle spasm that the back creates to protect the vulnerable area, the joint strain above and below the worn disc that has to compensate. This is why the pain feels like it moves, why it is sometimes in the lower back, sometimes in the hip, sometimes down the leg. It is all connected to the same worn disc. The second cause is weak core muscles, and this one is the most important cause of ongoing back pain in seniors, and the most overlooked. Your core is not just your stomach muscles. Your core is the entire system of muscles that surrounds your spine like a corset. Front, back, sides, above, and below. When this corset is strong, it holds the spine in its correct position. It takes load off the discs and joints. It allows you to move without straining the spine every time. When the core weakens, which happens gradually from midlife onward, especially in people who sit a lot, the spine loses its support system. Now the discs, the joints, the ligaments, they all take more load than they were designed for. Every step, every sit, every stand puts more strain on structures that are already worn. And the result is that familiar, relentless back pain. Here is the crucial thing. Most people with chronic back pain have weak core muscles, not because they are lazy, not because they did not try, but because nobody ever told them this was the root of the problem. And nobody taught them the specific gentle exercises that rebuild core support safely. Painkillers do not strengthen the core. Rest actually weakens it further, and many standard exercises are too aggressive for a senior spine. But gentle, targeted core strengthening, done correctly and consistently, is the single most powerful thing a senior can do for chronic back pain. More than any medication, more than any injection. We will tell you exactly which movements help at the end of this video. The third cause is facet joint arthritis. Along the back of your spine, connecting each vertebra to the one above and below it, are small joints called facet joints. Like all joints in the body, these joints have cartilage on their surfaces. And like all joints, that cartilage wears down with age. When the cartilage thins, the facet joints become inflamed. They stiffen, they ache, and facet joint arthritis produces a very specific pattern of pain that many seniors recognize immediately. The back feels stiff and painful first thing in the morning. It eases after 20 or 30 minutes of moving around. Then later in the day, after sitting for a long time or standing for too long, it stiffens and aches again. Morning stiffness that improves with movement. Pain that comes back after prolonged sitting or standing. If that is your pattern, facet joint arthritis is almost certainly involved. The good news is that facet joint arthritis responds very well to gentle movement, warmth, and anti-inflammatory habits, including the right diet, which we will mention shortly. The fourth cause is tight hip flexors. We talked about this in our hip pain video, but it is so relevant to back pain that we must say it again. The hip flexor is the muscle that connects your lower spine to the top of your thigh bone. Its job is to lift the leg when you walk and to help you stand. But when you sit for long periods, which almost every senior does, this muscle shortens and tightens. And when the hip flexor is tight, it pulls on the lower spine. It tilts the pelvis forward. It creates an exaggerated curve in the lower back. That exaggerated curve increases pressure on the discs and facet joints in the lower spine. Every hour you sit, every day, for years. Many seniors have had tight hip flexors quietly pulling on their lower spine for a decade or more, creating pain they attributed to disc problems, to arthritis, to just getting older. But the hip flexor was pulling the whole time. The seated knee pull exercise, which we demonstrated in our hip pain video, is one of the most effective things a senior can do to release this tension and reduce lower back pain. We cannot overstate how important this one muscle is to back pain in older adults. The fifth cause is poor sleep position. We touched on this in our morning stiffness video, but for back pain specifically, it deserves its own explanation. When you sleep in a position that puts your spine in an unnatural curve for 6 or 7 or 8 hours, the muscles along that curve spend all night in a shortened, strained position. They wake up tight, inflamed, and they hurt. The most common sleep position that causes back pain in seniors is sleeping on the side with the top knee dropping forward. This rotates the pelvis. It twists the lower spine for hours. Simply placing a pillow between the knees when sleeping on your side keeps the pelvis neutral. It stops the lower spine from twisting, and many seniors notice a significant difference in morning back pain within the first week of doing this. One pillow between the knees every night. It sounds too simple, but the people who try it are always surprised. The sixth cause is inflammation from diet. This is the cause nobody mentions, ever. Inflammation is the process your body uses to heal injury. Short term, it is essential. But when it becomes chronic, when the body is in a constant low-level state of inflammation, it makes every painful condition in the body worse, including back pain. And diet is one of the most powerful drivers of chronic inflammation. Foods that drive inflammation in the body include processed foods, white bread and white rice, fried foods, sugar, and excessive red meat. Foods that reduce inflammation include oily fish like salmon and mackerel, olive oil, leafy green vegetables, berries, nuts, and turmeric. Many seniors eat diets that are heavy on processed and convenience foods, not from carelessness, but because cooking becomes harder when you are in pain or living alone. But the irony is that the diet that is easiest to reach for, processed, convenient, packaged food, is the diet most likely to keep the inflammation high and the back pain worse. Switching even a few meals a week to anti-inflammatory foods can reduce the background level of inflammation in the body, and that reduction is felt in the joints, in the back, and in the overall level of daily pain. The seventh cause, the last one, is the one that keeps more seniors in pain than almost any other, and it is the one that almost nobody talks about. It is not a physical cause. It is stress and emotional state. There is now very strong scientific evidence that chronic stress, anxiety, and low mood directly amplify pain signals in the body. The brain and the spine are connected in ways that go far beyond simple nerve messages. When the brain is under chronic stress, when someone is worried, lonely, grieving, anxious, or depressed, it amplifies pain signals. It turns the volume up on pain that might otherwise be manageable. This is not imaginary pain. It is real, physical pain, made genuinely worse by the state of the mind and emotions. Many seniors have chronic back pain that responds poorly to physical treatments alone, not because the body cannot heal, but because the emotional state is keeping the pain system turned up. Loneliness, grief, anxiety about health or money or family, fear about the future. These are not just emotional burdens, they are physical ones. Addressing mental and emotional well-being through social connection, through talking to someone, through gentle activities that bring joy, is not a soft extra add-on to back pain treatment. For many seniors, it is the missing piece that nothing else has provided. Now let us talk about what actually helps. The first thing is gentle core strengthening. Every single day. Seated leg raises, lying leg raises if comfortable, gentle abdominal tightening while sitting or standing, even standing at the kitchen counter and engaging the stomach muscles for 30 seconds. 5 minutes a day. Building the corset that your spine desperately needs. The second thing is the hip flexor stretch. Every day, before you stand up from any seated position, and every morning before you get out of bed. The third thing is warmth. A warm shower or heat pad on the back in the morning before movement reduces the stiffness and inflammation that peaks overnight. The fourth thing is movement. Gentle, consistent, daily movement. Walking is the best medicine for the back. Even 10 or 15 minutes a day keeps the spine mobile and the muscles active. The fifth thing is talking to your doctor about your full picture, not just the pain level, but the sleep, the stress, the diet, the emotional state. A doctor who understands the full picture can give you far more targeted and effective help than one who only addresses the physical symptoms. Before we finish, please hear this clearly. Chronic back pain does not have to be your life. It is not something you simply have to accept because you are older. The causes we talked about today, disc wear, weak core, facet arthritis, tight hip flexors, poor sleep position, inflammation, and emotional state, all of them can be addressed. Some more easily than others, but all of them can be improved. The seniors who make the most progress with back pain are not the ones who found a magic treatment. They are the ones who understood the full picture and made small, consistent changes across all of it. You can do that. Start tonight with the pillow between the knees. Start tomorrow morning with 5 minutes of gentle core work before you get out of bed. Start this week with a glass of water before every meal and one anti-inflammatory food added to your day. Small changes, consistent effort, real results over time. Today we covered the 7 real causes of chronic back pain in seniors. Disc wear, weak core muscles, facet joint arthritis, tight hip flexors, poor sleep position, inflammatory diet, and the emotional amplification of pain. And 5 things that genuinely help when done consistently. Share this video with someone who has been living with back pain for years and still does not have a real explanation for why it keeps coming back. That person deserves these answers. Subscribe for a new, simple, honest health video every week, made just for you. Take care of that back. Move gently, sleep well. We will see you next time.